ladies and gentlemen, and welcome once again. Thank you very much for joining me. I'm Dr. Derrick DeSilva. We are here at the Age Management Medicine meeting at the Bellagio Hotel in Las Vegas, November 2015. One of our faculty, Dr. Neal Rouzier, is joining me today. He has been part of our faculty for many, many, many years and is one of the most, should I say, coveted, one of the most respected people in the community. And I thank you very much for joining us once again, Dr. Rouzier.
Thank you, sir.
So tell me a little bit about what you do and what your journey's been like over the past 30 years, 25 years?
Probably 20 years. Let me explain to you what I do, why I do what I do, and how I've come to that transition. And it is an interesting transition that most physicians are now experiencing in their lives because of the politics and economics of medicine. I have incorporated into my practice what's called, or some people call, preventive medicine, age management medicine. There's various terms for what we do and exactly why we do what we do. The essence of it is that we prescribe hormones, vitamins, supplements to help improve health, wellness. The accolades that I get from physicians that we've trained, you've changed my practice forever. You've changed the lives of my patients. What I see in my practice is the same thing. I can't thank you enough for the way you've changed my life. I can't thank you enough for how great you've made me feel.
What do you think this is due to? Is it the hormones? Is it the supplements? What is it?
It's a multitude of things. It's multifactorial. Let me start with the hormones. Most physicians are not aware of optimizing hormones. Oh, your hormone levels are normal, you don't need it. All the medical literature supports if your levels are not optimal, that's what we do, we optimize hormones. It makes people feel better, it makes people function better. But most doctors don't quite understand or grasp that it's the medical literature that tells us and teaches us that the higher your levels of hormones, the better off you are. Most doctors will think, oh, hormones, the synthetic hormones, you shouldn't take them. ACOG and NAM say, well, no, you shouldn't take hormones. Many of the patients out there know and understand they don't want or utilize synthetic hormones. They want what some people term bioidentical hormones. As far as women's hormones, estradiol, progesterone. There's health benefits, there's feel-good benefits. There's not any of the harm or problems, complications, side effects associated with the estradiol, progesterone that there are with the other hormones. When women see that and they know that and they read that and they understand that, they're perfectly content with taking those hormones. But what most doctors are not aware of, not familiar with, is prescribing thyroid to optimal levels and testosterone to optimal levels, because it's not commonly done. We're not commonly taught that. I was not taught or trained that in my residency. But when you come to AMMG, we teach you and show you how to optimize those hormone levels. That's based on what the medical literature says, provides excellent health benefits, but it's the feel-good benefits. That's what drives the practice. That's what drives patient referrals from other patients, not from other physicians, from other patients, because we make them feel better. So the hormones make people feel better. They enable you to have better strength, energy, endurance, which then goes into what benefits you'll see from exercise. Without the hormones, you will not see benefits from exercise. I'm too tired, I'm too fatigued, it doesn't work, I can't do it. Once they're on the hormones, they can do it, it does work. That makes people feel better too. Then you add nutritional support to it, you add diet, lifestyle change, which is what we teach here at AMMG, and it's a package deal. And when those patients see how they feel, that's great. But what floats my boat the most is what patients come back and say, I went to my high school reunion, everyone says, what are you doing? You look fabulous. You are a completely changed person from what I saw 5-10 years ago. That's what motivates patients to continue to do it. And that's what our practice is about. We've taken a practice where we used to treat disease and illness. We control the disease. We prescribed a lot of different drugs and medications. Yes, that's what doctors do. This is preventive medicine. People want to get off the antidepressants, they want to get off the cholesterol medicines, they want to get off the diabetes medicines, they want to get off all those medicines. Well, you can't just stop those medicines. You have to change something in your lifestyle, diet, exercise, routine, and hormonal replacement in order to see an effect. That's what makes people feel so much better. That's what drives them into the practice. That's how my practice has changed. That's what we teach other doctors how to do. That's what changes their practices, and you'll see all of these doctors are now going towards age management medicine practices, getting away from the insurance, the Medicare, those practices that restrict them, do not give them enough time to spend with the patients, and it's not rewarding.
Why are physicians afraid of hormones? Because I've seen physicians that are afraid of them. I've seen patients that are afraid of them. Why are physicians afraid of them?
They're not taught, trained, educated. They were taught that the world is flat. It's not flat. It's round. Yeah, but that's what we were taught. That's what we were told. What you were taught and were told, unfortunately, is not necessarily correct. That's why we use all this evidence-based medicine at this conference to show doctors, yes, that's what you were taught, but look at the literature showing if you optimize thyroid, if you optimize T3, if you optimize testosterone, look at the health benefits of it, look at the feel-good benefits of it, look at what the medical literature shows. They're not aware of the medical literature, and most physicians, if they're not up on it, they're down on it. They're not up on it, they will be down on it because they're not up on it. They don't understand it. You come to the conference, you'll see other physicians doing it, you'll see how we do it, then they become more comfortable with it. It's not something that we're taught or trained. If we're not taught or trained, we're uncomfortable with it, and we fear the side effects of breast cancer with the synthetic hormones. Oh, well, then all hormones must be bad. That's not true. The hormones in your body have health benefits. When you lose those hormones, you lose the health benefit. Replace them to optimal, people feel and function so much better. We're just not taught or trained, and as a result of not being taught or trained, we fear it.
So, tips on getting started in an age management medicine practice. I know that you do some amazing courses. You've got, I can't even think about how many physicians have attended your courses. What do you tell them?
So for the physician that is not aware of what we do, completely clueless, do not understand it, go to the AMMG website, look at it, become interested in it, attend a conference at AMMG. When you attend the conference, you'll be taught the basics, but you'll also be taught and introduced to other courses that you can take that will train you and teach you, and it's very, very simple to do. How to prescribe, monitor, and adjust hormones, supplements, lifestyle change, etc. We'll teach you and train you how to do all of those things. So I don't expect the physician to be able to go home Monday morning and say, okay, well, I read an article on it, now I'm going to incorporate it in my practice. No, you come to the courses, you get trained, you become educated, you become familiar with it, you listen to all the different faculty speak on the topic, and then you become motivated, you take the courses, and then you can go home on Monday morning and implement it, and then you can start doing it. It's quite simple. It's very easy to do.
You've been doing this quite some time. You're an ER doctor. I've heard the stories that you've told about the nurses in the emergency room, the nurses that you have seen. Is there any one story, is there any one patient that really stands out in your mind that says, I really changed that person's life? Or are there multiple?
If I was to tell you all of the stories about all of the patients, we'd be here for the next month. But let me tell you how I got started, and let me explain to you how that sort of lit the fuse. I started treating some of my nursing staff in the hospital, in the ER, and in ICU. They begged me to prescribe hormones to them. I do nothing about it. I'm not a doctor that prescribes hormones to menopausal women, perimenopausal women, PMS women, and fatigue women. I don't do that. I can do trauma procedures. I'm great at that. Please don't ask me to prescribe hormones to you women. They begged me, I did. They all felt fabulous. When they felt fabulous, they told other nurses.
How long ago was this?
This is 20 years ago.
Okay.
They told other nurses. Suddenly all the other nurses were at my office wanting me to prescribe. They wanted Dr. Feelgood to prescribe all the hormones that made everyone else feel better. They were fatigued. They were gaining weight. They were miserable. They didn't feel well. They had no energy. All I did was what the other nurses told me to prescribe for them, based on what one or two of them had been taking. I didn't know what I was doing. I was doing what they told me to do, because that's what made them feel better.
It's amazing what happens when you listen to your patient, isn't it?
The wise old professor once said, if you listen to the patient long enough, they'll tell you what's wrong. And if you listen even longer, they will tell you how to fix it.
Right.
I'm not accustomed to listening to my patients, but I did listen. I listened to the nurses. Finally, I had to give a grand rounds of the hospital because the doctors were curious, wondering, upset as to what I was doing. What was Dr. Feelgood doing that made all of the nurses hold him high on a pedestal? And what was I doing that none of the other doctors were doing because they didn't know how to take care of women? I didn't know what I was doing. I was doing what they were telling me to do, and it made them feel better. And I was just listening. That's how I sort of came to know and understand based on what they were explaining to me. I had to give a grand rounds, and there was about 50 nurses that showed up at this grand rounds and told all of this big group of doctors that we did not understand how to take care of women, how to treat women, how to make them feel better, how to improve their quality of life. and we were clueless as to what made them feel better. It was an eye-opener for me, it was an eye-opener for all of us doctors, that the nurses were so adamant that they felt so well on nothing else but what I did. That was the eye-opener to me that just led to this explosion of, I need to read more, and now I'm teaching every week, giving courses to doctors on how I do what I do and why I do what I do.
What's your message to the physicians and perhaps even the patients that are watching this video out there?
I'm sure as far as physicians are concerned, most physicians have come across 1 or 2 or 3 of these patients that have said, I'm on hormones and I feel tremendous. And they scratch their head and go, well, that's fine, but what's the free T3 and why are you on T3 and why are you on thyroid? It doesn't make any sense to me. When the patients explain to the doctors that they feel so much better, and it's nothing what those other doctors are doing, it makes the doctors perk up and listen and think, that's interesting, that's something I don't know about. But I keep seeing these patients that tell me they feel so well on the hormones and they don't feel well on anything else. So once the physician starts to see and understand the feedback from the patients and why you've lost 10 pounds, your cholesterol's much lower, you look better, you feel better, you sleep better, you're off your antidepressants, there must be something to this. So it will spark or pique the interest in the physicians. As far as patients are concerned, this is a patient-driven specialty. I do not advertise my practice. I'm so busy as it is now, but I'm not busy doing the things that I used to do, treating cardiovascular disease, diabetes, high blood pressure, etc. I do what's preventive medicine. And I treat patients, they feel so much better. They refer the patients who refer the patients that refer the patients. You have to go see Rouzier. What are you doing that makes you look so good? And why do you look so good? What are you doing that makes you look so good? I'm on hormones. Yeah, but you were exercising before. I wasn't on hormones.
So that's the difference. The difference is paying attention. The difference is, in my mind, getting the education, especially from a physician perspective.
Absolutely. The physicians need to get the training, need to be educated. It's very simple. What you've seen here, Derrick, at this conference is there's a smattering of all specialties here. There's anesthesiologists doing pain medicine. Patients on pain medicines really need hormones. Their levels are 0. There's ER docs doing this. There's general practitioners. There's family practice doctors. There's a whole room full of OBGYNs. There's a few endocrinologists, although they are in their world thinking that, no, that's not the way we were taught or trained. There's surgeons. There's cardiovascular surgeons. There's plastic surgeons. There's cosmetic surgeons, and they're all doing this. It applies to all patients in all groups, old, young. We all want to maintain our health. We all want to maintain our aesthetics, and we all want and must maintain our quality of life. That's why this practice has become so popular with patients. Right? Physicians not aware of it. There's no venue for them to go look at this at other medical academies. Although I teach for the American Academy of Family Practice, I'm teaching their anti-aging hormone courses in Texas, and now all of those doctors are becoming educated and trained and understand. Wow, this is definitely the way of the future.
Right. This is all about, for me, again, and it sounds like for you, all about education. I can't thank you enough for spending some time with us today. Thank you very much for joining us.
Dr.
Thank you
DeSilva,
for all the
thank you,
great
sir.
work that you do.
Thank you very much.
It's been a pleasure to have you with us, folks. Thank you so much for spending some couple of minutes with us here today. And until next time, I'm Dr. Derrick DeSilva, and may you always be blessed with good health.
Thank you.